I'm James Gilling. I manage the Policy and Sector Division, and we have responsibility for the health work of the agency. Malaria is one of the most significant diseases in the world. We think across the globe about 655,000 people a year die from the disease. In our region it's about 43,000. So that's a huge number, and it's something that we really want to do something about.
I'm Brendan Crabb. I'm the Director and CEO of the Burnett Institute and also a malaria researcher. Malaria is an infectious disease caused by a microscopic parasite that's transmitted by mosquitoes. But it's a development issue because it has a profound social and economic impact on many, if not most, of the countries in which it's endemic. And it has done for the whole of human existence, and it continues to have that level of profound impact to this day.
Malaria is a development issue for two reasons. First of all, it's a development issue because people dying is a development issue. It's an international outrage, and it's something that we want to do something about. It's also an issue because people who have the disease are less productive in the workforce. They find it harder to work in the fields, to work in the factories. It's just a very difficult disease to work with.
I am Vijay Jha. I am from Nepal. I work in a Mahatari district, which is located at the southern border. Malaria is a communicable disease, and it is related to the sanitation. So there is many cases from the backward community, the poor sanitation. So it has a vicious kind of cycle. It makes the people more poorer, and the poorer have the many cases of malaria. So it kind of makes vicious cycle. So it's a big impact on the productivity, the economic growth of the country.
Well, malaria is treatable and preventable, and it's some of the barriers to control and elimination are simply whether people and governments know about those methods and how to best apply them in their setting.
What we're trying to do is get technical and political buy-in to a solution to the problems that we face with malaria in the region. In particular, we're interested in the issue of drug-resistant malaria. That is becoming a very important problem.
My name is Rob McKelleher, and I'm Program Manager for AusAID's Australian Leadership Awards Fellowships Program. Malaria continues to be one of the priority health issues for Nepal. So this fellowship program will bring in district officers who work in some of the malaria-prone districts in Nepal to Melbourne to undertake some professional development training. The intent of the training is for these fellows to acquire some new skills and knowledge which will help them back in their districts to deliver effective malaria control measures.
Many things is beneficial, the experiences, the exchange of ideas with the people here, with other group of people from different country, the Myanmar people, the Burma, and Afghanistan. We shared much more regarding our health matters. So we learned many things from those cultures also, and definitely from this Burnett Institute and ALA program.
I'm Tony Stewart. I'm a medical epidemiologist here at the Burnett Institute. Each country has its own unique problems. We have a broad view of it, but it's only when you get down to the grassroots level that you really understand the impediments that each country is facing to try and manage things like importation of malaria cases from neighbouring countries, or limited resources, issues with strengthening governance and so on. And through these ALA programs we're able to have detailed discussions and learn what the real impediments are, the real hurdles to be overcome, and where most effort needs to be made.
My name is Srijana Shrestha. I am from Nepal. I work in Ministry of Health and Population, Department of Health Services. In high-risk areas, indoor residual spraying is going on, and another insecticide treated bed net we have, that is also distributed in high risk areas, and other medicines for malaria, it is distributed in our different health organizations like hospitals, primary health care, health post and sub-health post. All the medicines are free of cost.
Well, Australia has a very comprehensive program to address the issue of malaria. The first thing we're doing is providing funding for organisations like the Global Fund and the WHO, who have an important role to play to control the disease. The second thing we're doing is we have got dedicated investments in parts of the Pacific, particularly Vanuatu and the Solomon Islands, where we are trying to eliminate the disease.
Malaria parasites don't obey border control. Mosquitoes fly across borders, and so there is simply no point in having a national-only program. There must be a collaborative approach to malaria control amongst countries in the region, particularly ones that have a direct influence on one another.